As Chelsea said, I'm Debbie DiazGranados. I'm associate professor in the School of Medicine. And my core research over the last 10 years has really focused on teamwork and leadership. My general background is in organizational industrial psychology, which is the science of the workplace, so how individuals interact with each other, with systems, with the organization as a whole. And what I'm most interested in are the challenges that individuals face when working in teams, or even when leading teams. So my overlying motivation in my research is to identify ways in which individuals can work effectively and productively, but also be satisfied with their work. I'm fully aware that work is only one small portion of our life, and if we can make that effective, I think we can help to create a well-rounded way of life. So to that end, one of the recent research findings in the literature, especially because we're on Zoom a lot and working virtually a lot, is if the engagement of individuals when they are on video increase. So while I understand the limitations of that, whether it's having good connection, having too many individuals at the home needing to get on the internet, when possible, if you can put on your video, I would love to see who I'm talking to. And with that said, at any point in time, please ask questions. And there's definitely times where I'm going to ask you for a response to some of my questions. All right, so today's goal is for me to share with you some of the knowledge about leadership and teamwork. And that may help you now as a student, but also in the future. But I also want to challenge you in thinking about what leadership and teamwork is, particularly some of the traditional views of leadership. So I'm hopeful that we can have some dynamic conversation around that. So what am I going to talk about today? We'll talk a little bit about leadership, introduce this concept of shared leadership, whether or not, I don't know if you've heard it or not. Talk about team dynamics. What are effective team dynamics? What are your challenges? This is definitely the area where I want to hear from you. And what can I offer in terms of what I'm presenting here now, but also the decades of research that I haven't presented here. Maybe there's something that I could offer you based on the challenges that you might be thinking about. And then kind of sharing some tips as to what you can do. Again, pointed, targeted tips. There are many others, but wanting to focus the conversation since it's a short 45 minutes. All right, so first question to you all, what is leadership to you all? How do you define leadership? Both structurally, but also even generally. Like what does it mean to be a leader? What is effective leadership? What is poor leadership?
The first thing that comes to my mind is motivating action in others.
Okay, motivating action in others, definitely. Getting people to do something, getting people to find their passion, maybe even. Anyone else? And that is a very a big portion of kind of the leadership research is on how do people motivate others. Now, as I'm preparing the presentation, I went to my trusty Pixabay because that's where I get all most of my images for presentations. And the top 3 images for the word leadership are these 3 pictures. So in the first 2, specific one person, right? I was saying maybe we have 2 people in different instances representing this term. But then also this term of one in front of others that might be, that person may be motivating those to pick that arrow up and move them in a direction. So if we think about this definition or these pictures of what leadership is, it feeds into our traditional view of leadership, that it's an individual, that the individual is making the motion and or motivating others to do something. And the reality is when we think about leadership, and often people talk about whether, whether it might be authority. People have, the leader is the person who is able to make that decision, has the authority to make the decision, has the authority to spend money. They're in a position or have a title of director, president, CEO, whatever it may be, even a faculty member, professor, as compared to a student. They may have personal attributes like extroversion. And there's a lot of research more recently that really has shown that extroversion is not predictive of effective leadership. And that these personal attributes that we traditionally viewed leaders, or traditionally think about when talking about leadership, are truly not necessarily what makes and defines leadership. So, my point, is this leadership? No. Could it be leadership? Yes. But what I'm hoping to, I guess, engage in a conversation is challenge this idea that when you hear the word leadership, it's no longer this individual person, but rather it's behaviors and actions of an entity to accomplish something. So, the formal definition, which again isn't even necessarily highlighting an individual, but that it is a process. So even if we think about the definition in front of you, and we think about it from an individual perspective, so one person, well, one person cannot always influence, because we're talking about engagement with people over time. So that is why it becomes a process. Noticing that the elements of this definition are that it stems from social influence and not authority and power. So it is motivating and having that kind of social influence on others. Another key aspect of this is that leadership requires others, and that it doesn't necessarily imply direct reports. So I don't know if you all ever had seen, I should probably been now 10 years, there was a video of a person at a festival dancing, kind of dramatic and big movements by themselves, and all of a sudden people start flocking to them and start dancing in this way. Those people were not that person's direct reports, but it was an illustration of someone having some kind of influence on others to say, you know what, this music is that good, and let's start dancing. And there's no mention in this definition of personality traits or attributes or titles, but most importantly, it does include this reference to a goal, to an outcome, to something, and that goal may be tactile in terms of a report, in terms of a grant application, an article, an assignment, but it also can mean a goal of movement and community advocacy. So it is about having that endpoint. So as I'm trying to challenge and or shift kind of the perspective of how you might view this term leadership, thinking about it in terms of shared leadership, and not one single person, but actually thinking about a phenomenon, a relational phenomenon that involves the mutual influence between team members that are working towards an objective or a goal. So it's about ensuring that all participants are able to express their agency and express their perspective and expertise in order to layer and then become more productive than if it were one individual. So if we think about our roles as students or faculty members, we are dealing with complex problems and complex issues that we cannot solve on our own. So the notion that the shared leadership, and the research has shown that when leadership is shared, when individuals take that agency and act by making decisions and providing backup behavior to ensure that the team succeeds to that end goal, we can start saying, I have one perspective that can add value to this problem space. Chelsea has another perspective that she can add value to this problem space. And without that combination, we cannot get to our end goal. So all of this to say is, can we, when we start hearing the word leadership, we now start saying it is no longer one individual, but it is a collection of individuals. And, again, if you think about a university, the university is a large institution. Yes, we have one president, President Rao, but President Rao is not accomplishing all goals for the university. There is shared leadership amongst provosts, chairs, deans, faculty members, students, in order to accomplish that mission and that vision for the university. So how do we do shared leadership well? Well, then now enters team dynamics. When you think about how you interact with others, and when you are working together to achieve a goal, the idea is, does this collection of individuals share in that goal? So as a professor in the School of Medicine, I am motivated by what my school, my dean rewards me on. Now, if I collaborate with a faculty member in the School of Arts, it is very probable that the reward system for the School of Arts is very different than the School of Medicine. Now, it doesn't mean that we don't have a shared goal in whatever reason we came together. We came together because we want to build a program to improve patient care. But we do each other have to keep in mind of the potential conflict that each of our individual level goals may have on that shared goal. So I think thinking about that in terms of your team, and engaging in communication for getting this out on the table, if you will, helps to improve the team dynamics. So interdependence of members. This is a key aspect of teamwork. If we are not interdependent, we are not a team. We are a collection of people. We could be in my mind, I'm imagining the I Love Lucy conveyor belt. We are that. We are a people around a conveyor belt where I do something to something and pass it off, and then I don't see it anymore. Without interdependence, we are not a team. And when we do have interdependence, the aspect of team dynamic and how we share leadership then becomes more critical. It's understanding our independence. How am I interdependent on Justin or Chelsea or Genevieve? We're bounded by time. And by time meaning there are iterations there are episodes of how we do our work and how we engage in one another. And we operate in a context. We operate in the context of, students in a classroom, and whether it's, Psych 101 or the last class that a student takes in their student years, or we're at VCU or in the School of Medicine or the School of Arts and the School of Nursing. So we operate in a social context, in a system that does have influence on how we engage as a team. So success in teamwork is highly dependent on the strategies and processes in place. Research has shown that it's more predictive. Teams that are able to succeed most, be most effective, are those teams who have these strategies and processes in place in order to catch them when either something goes wrong, something goes in a different direction, when they have to adapt, when they're knowledge teams, because it provides a place to encourage collaboration and to encourage shared problem solving. So I guess I want to open it up to those on the call. What are your challenges, and what was your desire? What is your desire out of coming to this 45-minute discussion in trying to answer some of the conflicts that you might have? I see somebody new.
So I don't mind speaking up. Because I don't know, there's only 3 of us, I think, or 4 of us, but as a faculty member, I was interested in this just because I'm interested in teen dynamics in general, but also how students perceive themselves on the healthcare team, and I didn't know if we could touch on that at all. So that, I can't remember all parts of the question you're asking, but that was my motivation for attending today.
And I think that's a really good question, because one of the things, some of the research that I do are with medical students, and often there is, especially within the healthcare system, like they don't know how to find their place. And it becomes complex because, one, you're talking about students who are changing from, I'm a student where the first few years of my education has been primarily focused on myself, learning content, being tested on that content, and now I'm being placed in a workplace. And I'm no longer the center because the patient is now the center. And I'm just trying to add value where I can, but some of the people around me may not see where I can add value or are not being explicit as to how I can add value. So I think that's a really good point, and I'd love to have more discussion about that. And I see somebody else new.
Yes, hey, I had a question. I work with a lot of teams where folks report to different leaders and different businesses and entities, and it's been a challenge to keep people motivated in that kind of situation.
Mm-hmm. So I think that's another good point, because that's often, we're all probably very much stretched thin, and just trying to figure out how do we keep motivated and how do we keep plugging forward, as we have so much to do in engagement. So when I think of that question, I think about engagement and ensuring agency. So if we can find our place, kind of back to the comment for Genevieve's reason for coming, like if we can find our place in the team, we now know, we have a better idea of what we can do to add value. If we do not see ourselves in this team, we are not motivated to add, to speak up, to do the work involved for whatever that business is or the healthcare team. So at least, so if I can talk a little bit about from the medical student's perspective, and Genevieve, let me know, like add your context knowledge too. So from the medical student's perspective, residents are busy, interns are busy, workload on interns are high. The student comes in, and again, this added, we talked about the context in which we work. We have to consider that when we're thinking about these examples. Because if you think about the student is still being evaluated. Yes, they're in the workplace, but they're still being evaluated. They still have concerns about how they might look like in front of attendings, in front of residents, because they still have to worry about matching. So thinking about all these layers from the student's perspective. And they come onto a team and the residents are busy, they're stressed, they're overworked, they're dealing with many, many things. And now they're having to integrate a student who is a novice and certainly is limited as to what they can do. But now you're adding a layer to the workload of the resident. So if there are ways that we can develop residents or the people within that workplace to be able to say, this is an aspect, this is a way that you can add value, and sharing that with the student. So I think this transparency of saying, this is how you can add value, this is what you can do, this is what I expect. Then it becomes clear for the student. And I think with the other question that Logan asked is, identifying, if you have the different bosses, what are the expectations of each, and being able to have that conversation as to when there might be conflict. And being able to be engaged with both or many bosses or people that you have to report to in order for them to understand their added value to that business entity, and how, if it is a coordinated effort across departments or across bosses, how it all is beneficial to the overarching goal. That makes sense. Now, having a little more context in terms of the example, Logan, would probably help me in being more targeted, but I think the idea of the expectation and transparency and communication.
That was helpful. Thank you.
Sure. All right. Well, and so if you think about both, maybe from both of the questions, and Chelsea, did you have a comment or a question or a perspective to add?
I would say, just as far as what you mentioned earlier, the varying roles that you may play on a team, that's something that I'm kind of in the middle now, between work, and then I'm also in school and we do various group projects and that sort of thing. And so understanding that you play different roles on different teams as well.
And in terms of motivation theory, we are motivated by our rewards, but we are also motivated by what we have the capacity to do. And if we can start defining and thinking about how we do our work in our different roles, and perhaps even because they are likely in teams, and if we can start thinking about how we as a team in role A are acting and are coordinating, and we can start kind of unpacking that onion into truly kind of thinking about how it is that we engage in these episodes. So the idea that when we work, we engage in shift between episodes, this idea of transition, this idea of defining, think about the process of building a presentation. You have to figure out, well, what is my point? What is my message? What is my goal, and how am I going to do it? What is my strategy for doing it? So that's part of the transition. The action is actually putting slides together and putting, pen to paper and words on paper. But going back and forth through these episodes are essentially how we do our work. And if we can start defining our work in this way, maybe we can start identifying when we have conflict, when we have, when we're unable to fulfill one role and give more to another role. And I think also understanding that interpersonally, we engage in interpersonal processes throughout the entire time we do any kind of work. And whether that interpersonal process right now is primarily through Zoom meetings or even through email, because a lot of my communication now is obviously through email, is understanding that is continuous throughout how we do work and has a major influence as to how effective we are. Okay, so we talked a little bit about the challenges that you talked about. So I guess in my preparation for this, I was thinking about, the student perspective as to, I'm only a student, what can I do? And I think thinking about the system in which the students are working or that you're working in. So being able to say, thinking about it in the terms of the big picture, taking yourself out of it first so that you can see the interconnectedness. With the example of the medical student is, the student is learning, but they should take themselves out of it for a second to be able to say, I see the complexity that the resident has in terms of workload and pressures themselves. I see the complexity of having to deal with patients because they are the center of our patient care. But being able to see the patterns of relationships and processes so that when I can identify that, I can maybe find my fit and my value. I think for the student perspective, identifying and understanding what is it that they can learn. And I think, because we're in an educational environment, for students, when they're in the classroom, they have learning objectives. They have, a clearly stated learning objectives are the first step in a class. What are those learning objectives for the clinical space? And because oftentimes I hear students saying, well, they want to be able to observe surgeries, or they want to be able to observe and do things, but maybe perhaps first they need to show their knowledge in another way. So I guess, Genevieve, if I could ask you a question, how do you see it, as I've described at least the situation from a medical student perspective, how do you see it from a nursing student perspective?
So I think it's similar. I think there's just a lot of competing demands of nursing students when they're in the clinical space. And I think often nurse educators and preceptors on the floor have challenges with not trying to just orient them to the floor as much as just teaching them to think like a nurse. And so I think people often get caught up in being too skills focused or task focused, whereas because that's what the day-to-day work requires, but instead trying to focus more on transferable skills. I think that's something as educators we're always trying to work on. The other piece that I think is really interesting is how nurses transition into practice and have to immediately go from being in that student role to being a leader very shortly. Their orientation is 3 months, which is a lot shorter than probably residents get. And so that I think is a tough transition to go from student to hitting the ground running.
Right. Well, and I think so that one thing that I have heard is, and I wonder, well, so I've heard students, third-year medical students or fourth-year medical students say, I can't believe, like I now interact with second-year medical students or third-year medical students as a fourth year, and I can't believe how little they know and how much I know. And I do wonder if there is a way of, and they also talk about how they've developed their sense of how they talk to patients, how they build, and how they found their way, their method of talking to patients and interacting with patients. And kind of to your point of building these transferable skills, can medical students and nursing students, the framing of what they're gaining in the clinical space be that, thinking about this as a safe space where you can start observing those that are in the role that you will be in, but also practicing how you build the skills of patient interaction or even colleague interaction, and kind of those, like you said, transferable skills that then will be more valuable to them as they take on that leadership role. So I think the other thing is about, learning to maintain equilibrium and resilience, and specifically in solving complex problems, whether it's in healthcare, whether it's in business, environment, social justice. We're building, it's important to build those practices now. So kind of, building off of what I was just saying, like having these students build off of things and develop their processes and build their practices for self-reflection and mindfulness now, so that they start building better habits. And, I'll use myself as an example. If I could have built those skills and strategies as a graduate student, I think that my first few years as a faculty member might not have been as stressful. and practicing communication. And communication, while it is often attributed to the success and or failure of teams, it is just one aspect, but it is very important. I think understanding that for effective communication to occur, there are many underlying factors that need to also be in place, that need to be the foundation. So that issue of trust, you know, if you're thinking about from the student's perspective, I may not communicate freely or openly because I don't know that I trust the resident or the attending to not judge me poorly and not mark me negatively in terms of my evaluations. But communication and understanding and evolving that language of communication and ability to build that skill in the workplace. But then also, like, I guess from the student perspective, developing these skills as students now, because this is an environment where, you know, even, you know, faculty and students can learn and grow professionally. I think some of these are some of the things that can be done. All right, I know we have about 10 minutes. So a little bit about communication. The last two slides that I have are all about communication. So if good communication is common sense, then why isn't it more common? The more and more we are attached to our technology, the more and more I think our society is failing at aspects of communication. You know, in the age of social media, it's really hard to really kind of pin down what good communication is. We have communication through different modes, and understanding kind of where what the most effective mode of communication is imperative to kind of understanding how we're communicating in the workplace. You know, I think part of this aspect of mode can be also layered. Something else that can be layered on that is this issue of stress and or tension within the workplace. So whether it's patient care and having you know, just not enough resources, definitely has influence on communication. So effective communication isn't just the transmission of it. There is a pattern to it. So an exchange of information, and it can take place in a variety of modalities. So we think about the way we communicate with people on a daily basis. We send email, we send text messages, phone calls, face-to-face, and also nonverbal cues. That's, you know, one of the difficulties. I don't know if you have all seen much of the recent research about how being on Zoom is actually more taxing and more exhausting than being in day-long meetings, is because we sometimes don't get those nonverbal cues because people may not be on camera. We can see ourselves, so we're seeing ourselves in this conversation, which again is taxing to ourselves. But the point is we have numerous modes of communication, and it has its advantages and disadvantages. In the healthcare system, I think understanding how technology plays, the EMR plays in this communication amongst teams and amongst people working together, I think is crucial. So I think considering effective workplace communication and framing it in terms of thinking about the modality, the timing, the tone, the framing, and the feedback are important to effectively communicate. So there is a huge difference between listening and actually waiting to make your point. You know, arguably the most important of these communication skills is active listening. You know, it's being active and not passive, closely paying attention to what others are saying, to understanding emotion, understanding any questions that you might need for clarification. Having this, you know, we've talked about communication skills, but having this social perceptiveness, understanding how people are reacting, or whether it's in line with what you expected them to react to a message, but also self-monitoring and having, you know, having sent if you send a message late as in terms of a text message to a coworker, understanding kind of what that might mean in terms of that messaging. So these are some of the workplace communication skills that I think all of us here, students, others, can really practice, and maybe even start to unpack that communication onion and say, well, what aspect of communication is failing? Is it that we're not providing enough opportunity for active listening, or are we not engaging in social perceptiveness because we're so because our time, the time limits on our work is so stretched and so stressed. So that is all I have, and I know we have about 4 minutes. I want to be cognizant of time. I don't know if it hit the mark in terms of why you all came, but I would love to talk more. Would love to talk about opportunities where if this were something that you'd be interested in kind of researching or developing curriculum for, or helping faculty, preceptors to help students find their place and on the team. I would love to engage in that work.
One question I did have about one of your, I guess, final slides, how are you able to, I guess, show actively listening through Zoom? Like, how can you make sure that you're, showing that you're engaged, other than, showing your video? What are some ways or skills or tips that you can utilize?
Well, it is obviously a little bit more difficult when it is on Zoom, but I think just like in person, being able to see the person and being able to see visual cues of understanding, so nodding of your head and kind of facial expressions. I know our default when we're on Zoom, I think, is kind of a blank kind of stare, but because I think oftentimes we are multitasking and looking at other things. I think that's what makes it more difficult on Zoom. But really kind of focusing on some of those aspects of how people are engaged in the meeting or the call. I think a big point of facilitating Zoom calls or Zoom meetings is not assuming that silence is confirmation or consent to something. It's truly being able to say, Chelsea, what do you think about this? Or do you agree with this? And actually getting that verbal yes or no. Because Zoom definitely, some of the early research that's coming out now, it's just much easier to disengage and much easier to not contribute.
Mm-hmm. Thank you.
I had one question if we have a minute.
Sure.
Any suggestions on any readings or any book that can help sort of help become a better leader at workplace, or especially when you're in school and if you're going to get to the job in academia or research or somewhere?
Mm-hmm. The first book that came to my mind is a book. It's specifically by a researcher, faculty member. She is at Harvard, I think, Amy Edmondson. She really focuses on this variable, this construct called psychological safety. And the thing is with teamwork, it's not just one thing, it's many, it's very layered. But psychological safety is this aspect of being able to feel that you are psychologically safe in a team to taking risks, to speaking up, that you won't be berated, that there will be no negative consequences. And in the mindset of shared leadership, psychological safety has to be high in order for everyone to feel like they have a say in kind of the leadership of the team. So I would say Amy Edmondson's book, I don't think it's called Psychological Safety, but I cannot recall what the name of it is. But if you look her up, it was a recent book that came out a couple years ago.
Sure. Thank you.
Fearless organization.
Yes, fearless organizations, right? Yeah.
Yeah.
Cute.
Very fast read.
Yes.
you.